My name is Yoshiharu Ohno, Professor of Radiology and Joint Research Laboratory of Advanced Medical Imaging in Wichita Health University. This time, we publish our paper entitled Small Cell Lung Cancer Staging, Prospective Comparison of Conventional Staging Tests, FDG PET-CT, Whole Body MRI, and Co-registered FDG PET MRI in AJR. Firstly, financial disclosure is shown in the slide. Lung cancer is the leading cause of cancer-related deaths worldwide, and small cell lung cancer is more aggressive and has a worse prognosis than any other type of lung cancer. The first small cell lung cancer staging system was introduced by the Veterans Administration Lung Cancer Study Group in 1973, and it divided patients into the limited stage and extensive stage. The Basel system was developed at a time when the utility of surgery was being questioned. Although the TNM stage has not been considered as applicable to small cell lung cancer patients, a few investigations showed that a TNM stage was useful in predicting small cell lung cancer outcomes. Surgery and SBRT has been suggested as treatment for stage 1 patients, while combined chemoradiotherapy or chemotherapy has been recommended for other stages. Accurate clinical stage classification is important for management of small cell lung cancer patients in routine clinical practice. Conventional staging tests are most frequently used in this setting. As an alternative to conventional staging method, however, positron emission tomography and PET fused with CT combined with FDG has been suggested as useful in this setting. Whole body MRI and co-registered or integrated PET combined with MRI using 1.5 Tesla or 3D MR systems has been suggested as equal to or more accurate than PET-CT or conventional staging or recurrent surveillance methods in not only non-small cell lung cancer patients but also other thoracic oncology patients. We hypothesized that whole body MRI and co-registered PET MRI for small cell lung cancer patients has equal to or superior potential for Basel and TNM stage assessment than PET-CT and conventional staging method. The purpose of this study was to prospectively compare the capabilities for assessing TNM and Basel stages among whole body MRI, PET MRI, PET-CT, and conventional staging method in small cell lung cancer patients. In this study, 98 pathologically diagnosed patients underwent whole body MRI, FDG PET-CT, and conventional staging method before treatment. Details are shown in the slide. This slide shows the whole body 3D MRI examination in this study. All 3D MRI were obtained by two 3D MRI systems with STI fast advanced spin echo sequence, dual echo T1 gradient echo imaging without contrast media, diffusion-weighted MRI with EPI sequence, and quick 3D using double fat suppression technique with and without contrast media if contrast-enhanced MRI could be performed. Detail of the scan parameter is shown in the slide. This slide shows the PET-CT plot in this study. Standard lung cancer staging method is applied in this study. Details are shown in the slide. This slide shows the conventional staging test in this study. As conventional staging tests, unenhanced or contrast-enhanced MD-CT and brain MRI and bone scintigraphy were performed in all patients. Image and statistical analysis are shown in the slide. Standard reference for each factor, TNM stage and Barsuk stage, were determined by tumor board with more than 10-year experiences. T, N, and M factor, TNM and Barsuk stages were independently evaluated by each of two investigators for MRI and PET MRI assessment group and PET-CT and conventional staging test evaluation group, and final diagnoses were made by consensus of each two investigators. Diagnostic accuracy for TNM and Barsuk stage evaluation was statistically compared among all methods by using McNamara test. In addition, diagnostic accuracy for stage 1 case differentiation was statistically compared among all methods by means of McNamara test. Results are shown in the following slide. On comparison of imaging tests in terms of diagnostic accuracy for TNM stage, whole body MRI and PET MRI show significantly higher accuracy than conventional staging test and PET-CT. On comparison of imaging tests in terms of diagnostic accuracy for Barsuk stage, Whole body MRI, PET MRI, and PET CT show significantly higher accuracy than conventional staging tests. On comparison of imaging tests in terms of diagnostic performance for differentiating stage 1 disease from other stages, all methods have no significant differences. In conclusion, FDG PET-CT whole body MRI and co-registered FDG PET MRI outperformed conventional staging tests for various staging endpoints in patients with small cell lung cancer. Further, whole body MRI and FDG PET MRI outperformed FDG PET-CT for T category and thus TNM stage, indicating the utility of MRI for assessing the extent of local soft tissue invasion in small cell lung cancer. Given the findings, various approaches may be considered for incorporation of MRI into local practice patterns for the initial staging evaluation of patients with small cell lung cancer. Thank you for your attention. Please read our paper including supplement materials.